Good afternoon, super moms and super dads. I believe you all are safe and sound and taking good care of elderlies at home and children's as well. At the outset, I would like to thank Monica Madam and entire management of Callum High School for showing concern and agreeing to conduct this session, keeping in mind well-being of the children. I would also like to thank all the parents realizing the concern being present here virtually and supporting this initiative. Before I start my session, I have few instructions to convey. At the end of the session, we'll be having question answer session. You can see a window on the right side of the screen. You can put your questions, and in addition, Dr. Twinkle, who's here panelist, she'll be assessing all the questions. We'll be clubbing the common questions, and in the end, we'll answer all your queries. I recommend your kids, your children should be sitting next to you so that they can also understand role of exercise, yoga, and other things. Okay. So COVID-19 pandemic and ensuing lockdown has forced us to shut physical schooling, and we are introduced with the idea of digital screen or digital classroom or online schooling. This has started with the concept of bridging the gap in the education system. So this remaking of the way children learn certainly has a lot of challenges. And we are proud of teachers, we are proud of parents and children who are working hand in hand and leaving no stone unturned to overcome these challenges. You all deserve a round of applause. So, however, being an surgeon, I'm concerned about children being exposed to screen for 4 to 6 hours daily for almost 6 months or more, which is inevitable. I really thank all of you for taking efforts to fill the Google Forms. I have received around 475 responses. That was till yesterday morning, and they might have increased later on. We have analyzed the data, and what we have found is in last 6 to 8 weeks of online schooling, already 82% of the children having some form of symptoms of computer vision syndrome. That is in the matter of 6 weeks. Just for all of you to know, American Academy of Ophthalmology have suggested that uninterrupted exposure for the screen for 4 to 6 hours daily for very prolonged period of time, say 4 to 6 months, they are likely to have computer vision syndrome. And in almost 70 to 80% of the patients, and looking at our figures in just matter of 6 weeks, we are heading towards the same calamity. So to address this concern, we must be well aware of what is computer vision syndrome and how to prevent it. So this is exactly what we are going to deal with today. And see, government has hammered repeatedly what is social distancing, and we have been following it. We have accepted the norms. Now we should learn something called as digital distancing. Okay, so let's begin with what is syndrome. So let me share my presentation of computer vision syndrome. So computer vision syndrome is nothing but chronic uninterrupted exposure to the screen for a very prolonged period of time without taking breaks. So, and as we discussed, becoming like another pandemic. So I'll show you one image. That image will tell us. Can you see this image? So this image itself is a self-explanatory what a computer vision syndrome is all about. Here you can see there is eyes are straining and because of the repeated exposure to the screen. Now, how do you know that my child has some form of computer vision syndrome? So as per the data analyzed from the Google Forms that you all have signed, we have found that 24.3% of the children have glasses already, and around 10% and 15% are not very sure. So approximately you consider 15 to 20% of the children have some form of sensitivity to the light. There are other symptoms as well, like headaches. Some parents are complaining about dryness or gritty sensation in the eyes. Some are complaining about neck and shoulder pain. So this is another statistics which shows that around 20% of the children are facing watering. So around 30% of the parents are complaining of some form of headache. So my suggestion is you should, as the slide shows, less screen time and more green time. So this is what children need in today's era: less screen time and more green time. More green time, what I mean is a lot of green vegetables. So what is more important is less screen time and more green time. More green time, what I mean is more exposure to the green colors, which are very soothing to your eyes. So you should, expose your children more to a greener colors, and green also signifies lot of green vegetables should be added in their diet. So now we have understood what are the symptoms. We should also understand what are the causes which can cause computer vision syndrome. So first and foremost causes, so poor lighting conditions is commonly observed finding. So my suggestion is, since the schooling is between 9 a.m. to 1 p.m. and which is more of a natural light is available at that time. So my suggestion is, rather than keeping yourself in a closed room, where the natural light source is available. So because of the natural light source, what happens is your eyes are less strained, and natural sunlight is always better than a LED bulb. But just in case you have a disturbance after opening the windows and natural light is not available, in that case what you can do is you can keep your doors shut and keep your LED lights on. What is most important thing is that when you're keeping the brightness in mind, your screen, your laptop screen or your television screen brightness should be almost the same as a room brightness. That will put less strain on your eyes. Okay. Now we have understood what are the causative factors. We should also understand what are the ways to prevent this problem. So prevention is better than cure, as we all know. So you should always use a larger display. Larger display, preferably television or laptop. To my surprise, when I saw the analysis from the Google Forms that we have sent, around 12% of the kids are still using smartphones for the online studies. Big no for smartphones. You should either use laptop, and you should, otherwise, if possible, you should screen share your content from smartphone to your television, or you can attach HDMI cable and connect your television. Only concern when you put television on, only concern is how far to sit. Here, my recommendation is, for every 10 inches of television, you should sit approximately 1.5 to 2 feet away. Let's say your television is 50 inches television. So approximately 8 to 10 feet distance you should maintain. So that is very important aspect. Just in case you have any doubts, you can go through the brochure of your television to understand the distance part. Second most important thing is lighting conditions. So position your computer screen in such a way that you avoid glare, particularly from the overhead lighting windows. And as I said, lighting conditions should be natural light as far as possible. And if that is not possible, you should have a natural source of light. Secondly, when you have a LED light put up in the room, it should not make a shadow of that. Your shadow should not fall on the screen. That can affect your quality of vision as well. Now, next point is posture. Okay. Posture is very, very important aspect when you are doing online schooling. Okay. So can you see the image, posture image? This image looks very attractive but very difficult to maintain. So if you maintain this posture for 10 minutes also, you'll start having difficulty in maintaining this posture. But with time and with exercise and with regular awareness, these things can be managed. In this posture, what is most important thing you are seeing here is your screen is approximately 40 to 75 centimeter away from your eye level, and it is sustaining 20-degree angle below your eye level. That means your screen should be just below your eye level, and your feet should be rested on the floor, and back, neck should be erect, or your spine should be comfortably erect, so that you can maintain this posture for a very long period of time. So what I've explained to you is a very correct posture. What is incorrect posture is basically you're leaning forward and you're not looking at the screen, but you're looking at the your keypad. Next important factors which you should look at is adding moisture to your eyes or blinking very frequently. Now, for all of you to know, our normal blink rate is around 15 to 20 times per minute. And when we are exposed to screen of any form, maybe laptop or your cell phone or maybe television, you tend to blink less. So your blink rate comes down to 5 to 6 times per minute. So when you are blinking less, what happens is your eye remains open for longer period of time. And in this process, your tears get evaporated more and you tend to have more dryness in the eyes. Second important thing is lubricating drops. So this aspect will come to in the end when we'll discuss the treatment part. One more important thing is there are few recommendations of putting humidifiers in the room. If humidifier is not possible, what simple thing you can do is don't sit directly under the fan or do not let your AC blowers fall on your eyes. That will worsen your dryness. Okay. Very commonly prescribed treatment by doctors or exercise described by doctors is rule of 20-20-20. Now, what is this 20-20-20? After every 20 minutes, you should take a break for 20 seconds and you should look 20 feet away. What is the benefit of doing this? Many studies which are done in India, in abroad, they have proven that longer the exposure time in the external environment, lesser stimulation of the eyeballs, lesser elongation of the eyeball, and eventually possibility of developing myopia or nearsightedness is relatively less. So my strong recommendation is that if your children cannot move out, at least they can play in the backyard of the house. They can go to the terrace or they can simply sit in the balcony. Even they can, attend one or two lecture in your balcony. Now, there is a very recent concept about using podcast. What is podcast is basically, this is an app where audio content are replaced into video content through wireless earphones or external speakers. What do we do here is, suppose let's say a child is attending a Hindi class or English class where there is most of the time grammar is taught or stories there taught. So in this period, you don't have to expose yourself to the screen all the time. You can convert your screen into your audio, and that way you can reduce your screen time. Obviously, if you have a language lecture for one period, you can reduce your screen time every day. But just by this single tool, you can reduce your screen time by half an hour a day. That is pretty significant. Second way of doing it is limit your screen time by various apps available. And on Android phones, we are using screen usage, and on iOS phones, we are seeing digital well-being app, wherein your screen time is recorded, and you'll be shocked in the beginning when you'll see your screen time. It will be, apart from your schooling, I'm sure it will be around 2 hours or 3 hours. So once you're aware that you're using 2 hours, 3 hours of screen, gradually there are various apps available where you can, put a pop-ups where your WhatsApp time or your YouTube time, your Facebook time, your Instagram time, you can gradually reduce. You can set a limit, and that way you can have discipline for yourself so that your parents don't have to tell you anything about it. Now, next aspect is about various anti-glare screens. Now, for all of you to know, there are various screens available which you can put on your smartphones, you can put on your laptop, or you can even put on your televisions. So these screens are helpful, they are beneficial, they are not very difficult to get it. Only concern is that the quality of image is slightly reduced in terms of configuration. So that is one drawback of that, but still it does wonders. Most important point is meals should be screen free. Now, this statement can make me unpopular amongst the kids, but trust me, meals are the best time or great time for a little social interaction that we can have with our parents or with our grandparents. So next time, remember, when you sit down for a meal, try turning off your television and place your phone out of sight. Here, tip for parents is make a mealtime family time. Tell your children to leave their phones in the living room or in the bedroom. For that, you'll have to set an example. For that, you also have to keep your cell phones away so that the kids can follow you. Kids usually follow their parents, and if you set an example, they will certainly follow these rules. Now, this is a new development in terms of blue blocking glasses. So these blue blocking glasses, how they work is basically blue light is available all over, and it is good to certain extent. Blue light is good to have, but when you are exposed to screen, what happens? This blue light, you are exposed for almost 5 to 6 hours, and this blue light can potentially damage your cornea. It can potentially damage your lens, and it can damage your retina as well. So as they say, you should have a limited amount of salt in your diet. Salt is very important ingredient of your diet, but if you have excess of salt in your diet, you can spoil your food. Similarly, good limited amount of blue light is good because its natural source is sunlight. Next important aspect is, as far as prevention is concerned, various exercises are available. These exercises can help us to improve your strength of the eye muscles. So there are 5 different exercises. I have a video. If I can run, I can show this video evening. So first and foremost exercise is focusing what you do. Open the window, ask the child to look at a very distant object, and then ask them to focus on a finger. That finger should be kept up, and simultaneously ask them to focus at the distant object. So when you're doing this exercise simultaneously, what happens is your contraction and relaxation of the muscles will help to improve the blood circulation of the eyes. So this is a very important exercise that one should do, and you should repeat this exercise approximately 10 times in a day. Second exercise is Prataka. In Prataka, what we recommend is you put a candle next to your eyes, approximately at 1 meter, and it should be at the eye level. Keep your eyes closed, and after keeping your eyes closed, just try to imagine the space between your eyes and the candle. So, as we all know, vision is the function of the eyes. Apart means what you have seen, you can recall even without opening your eyes. So this is very important function of the eyeball or eyes. So for that, this Prataka exercise helps. It not only helps in improving the muscle, but it also to improve the muscle contraction. So now, since my video.
Number 3, massage. Massage your eyes with a gentle circular movement for 1 minute. Let's begin right now. Of course, while massaging, you shouldn't feel any pain, just slight pressure. Massage ensures better blood supply to your eyes. Number 4, tightly closing your eyes. Another thing you can do for the blood supply is close your eyes very tightly. When doing it, your face should look like a grimace of pain as shown on the screen. So make sure nobody can see you. Let's start. Close your eyes tightly for just a few seconds, and then open them and try to relax completely. Repeat 5 times. 1, 2, 3, 4, 5. Well done! Number 5. Pencil. Now take a pencil or a pen and hold it in front of your face at arm's length. Now start moving the pencil to your face very slowly, maintaining the focus on it. Continue until you can keep the focus no longer. Great! Now take a breather and continue. 10 times should be enough to exercise your eye muscles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Exercise available for this particular exercise part. I'll be sharing a link with all of you. Also available in yoga's most common 360-degree in clockwise fashion. To do that, what happens is you're exercising circulation of the eyes. There is one more exercise. Ask them to look in the extreme right gaze, then ask them to look in the extreme left gaze, then ask them to see up gaze, and then ask them to see in a down gaze. You can ask them to see in the right diagonally upside and then left diagonally downside. If you ask them to do these exercise 10 times a day, this is a wonderful exercise for your eyes. Apart from yogas and exercises, there are various Gharelu nuskas that our grandmother had taught us. So these nuskas you can apply. Where freshly cut cucumbers, you can keep on your closed eyes. Make sure that the juice or secretion from the cucumber should not enter in the eyes. Otherwise, it will inoculate the infection in the eye. So that care you should take when you put the cucumbers. You can put ice packs on the closed eye. You can put a back of a metal spoon just to keep relaxation to your eyes. Now, this is very, very important slide which tells us what are the best practices for safe online learning for children. See, I've gone through various studies which are available on net and also what we have been taught, but there is no exact guideline is how much time to spend on the screen for particular age. We have come to a conclusion. Let's say your child is 3 years or less. There is no educational calls, or there should not be there should not be any screen time. Let's say your child is 4 to 6 years of age. They should not spend more than 90 minutes with one break. If your child is 7 to 12 years, they should not spend more than 4 hours on your screen with 2 to 3 breaks. And if your child is between 12 to 16 years, 6 to 8 hours per day with 5 to 6 breaks, including long lunch break. These are the guidelines which are taught to us and which are been available online. And I'm proud to say that Calamai School is following exactly these guidelines. And also what I suggest is we should avoid digital modes of homework to reduce your screen time. Let's say you have done all sorts of exercises, you have done all yogas, you have taken all preventive measures. But in spite of all these preventive measures, if your symptoms persist, this is a time you should see your eye care professional. So what a eye care professional is going to do in his clinic, he will assess your tear production. He will see whether your eye muscles are working fine. Is there any component of lazy eye or amblyopia? In medical term, we call it amblyopia. We assess visual acuity for distance as well as for near. And as we discussed earlier, few eye drops or few lubricating drops are prescribed to take care of this problem. There are also, like we did one study in Calamai only 3 years back, where we studied around 250 children, where we found around 45 children were wearing glasses and around 15 to 20 children were not aware that they have glasses. So that is something called as uncorrected visual error that should be kept in mind. So annual checkup for your eyes is very, very important. Now, this is very common question of every mother is what a diet my child should have, and very pertinent question as well. So just to simplify, vitamin C, vitamin E and vitamin A, these vitamins are absolutely essential for every eye. Omega-3 fatty acids, luteins and zeaxanthins also play a very important role in development of our eye and to protect your retina. So now various sources of vitamin A, vitamin C and vitamin E. Omega-3 fatty acid, lutein and zeaxanthins are nuts like walnuts, Brazil nuts, cashew nuts, peanuts and lentils, which are commonly available in the grocery stores. You can purchase these nuts. Various seeds like chia seeds, flax seeds, sunflower seeds, they are also available in the grocery store. So you can use them and put them in a part of your diet. Various fruits like citrus fruits, as we all know, is a rich source of vitamin C. So citrus fruits or orange fruits like carrots, lemons, oranges, grapefruits, pomegranates, they are very, very important for our eyes. A lot of green vegetables that I don't have to say, all mothers know it very well. Broccoli, spinach, kale, collards, these are very important source of lutein, zeaxanthin, not only for kids, for elderly patients as well, or elderly parents which we have at home. It is very essential ingredient of our diet. Water, I mean, it is very important aspect of our life, but for all of you to know, drinking plenty of water can prevent dehydration in the eyes as well. So you can actually reduce your symptoms of dry eye with the help of adequate amount of water intake. They say for every 20 kg body weight of a child, 1 liter of water is good enough. I repeat, for every 20 kg body weight, 1 liter of water is good enough. So let's say if your child's body weight is 40 kg, he should drink at least 2 liters or approximately 8 glasses of water every day. So with this, we'll come to our take-home messages. So as we all must have understood that prevention is better than cure. Now, as we discussed, like social distancing, learn to adjust what is called as digital distancing. Online schooling is a new phenomena. Teachers, parents, and students are becoming more familiar how to navigate this through this problem. Annual eye checkup for kids is extremely important to understand if there is undiagnosed refractive error or glasses. Go green and less screen. This should be our motto for next 3 to 4 months for all the children who are using screen. Go green, as I said, means green leafy vegetables and exposure to green light as much as possible. Make exercises and yoga part of your daily routine. Visit your eye care professional whenever your symptoms are persisting. And most important thing is blue blocking glasses if your screen exposure is too much. With this, I'll end my session. For any guidance, for any help, certainly you can contact us on this number. You can visit our website or you can mail us directly. I'm sure there must be a lot of questions. We have panelists, Dr. Twinkle, to tell us. And go back to the screen. So there are various questions which we are seeing. Let us club few questions together and address them one by one. So there are 5 or 6 set of questions very commonly asked. First question is, how much screen time is okay? Okay, said there are fixed guidelines, but what we have been understood by various studies is that various studies which are done in Australia, America, and India, what they have recommended is if your child is between 0 to 3 years, there should not be no screen time at all. If your child is between 4 to 6 years, the screen time is approximately between 1 to 2 hours. And if your child is, say, between 7 to 12 years of age, screen time should not exceed 4 to 6 hours. If your child is between 12 to 16 years of age, his screen time should not exceed more than 6 to 7 hours. Now, the second question is about very relevant question. With the online schooling and COVID pandemic, whether there is any psychological impact on my child. Very interesting question, very good question, I must say. See, Department of Mental Health and various behavioral sciences have studied that they have pointed out that if they, because of the uncertainty surrounding to ongoing pandemic, this can give rise to feeling of anxiety among the children. Children can become, they can become irritable, they sometimes become angry and withdrawing. So this is the time a role of parent comes. Inability to meet peers also add more burden to their feelings. So we must understand their feelings, we must understand their emotions, and we should counsel them well. Otherwise, they will fall lonely and they feel isolated. So our support is very, very important in this incredibly strange time. It's gonna be a family effort to deal with this problem. To deal with this problem. Now, is there any way to take care of this psychological impact you can have? So my suggestion is you should, as I said, your meals should be screen free. So when the meals are screen free, children get more time to speak to their parents and they can divert their mind. You can reduce your, it's a very common habit that children are also falling into the habit of texting to their friends through WhatsApp and SMSs. So you can make a simple landline call to your friends that has more soothing effect and calming effect. That is what various studies have proven. You can play various board games on the at home with your parents. You can see any obstacle comes in our way, we should find the way out. This is a common say that obstacle is the way. So this is the time. Help your children to see this as an opportunity and ask them to pick up a new skill or engage in a new hobby like music. So music is very common way of divine, and this has a soothing effect on our brain as well. You can ask them to revisit your old albums. You can spend a quality time with elders, and there are so many other ways to deal with it. So yes, psychological impact is very important aspect. We should be well aware. If as a parent, if you are aware of this problem, it will be certainly a great help for your child. So that is one important aspect. Next question is, what is blue light, and is the blue blocking glasses really help or screen guards help? See, as I said, blue light is very important part of everybody's life. Even the sun rays or ultraviolet rays coming from the sunlight are part of blue lights. So blue light is everywhere. Blue light, what it does, it keeps you awake, it keeps you alert. So you see at many airports you'll see a blue light just to keep the passenger awake. So idea is to keep blue light is to keep yourself awake. Now what is blue light? Blue light is basically very high intensity light with a low spectrum, which can actually penetrate your cornea, it can reach lens, and it can also damage your retina. So blue light, as I said, I have given an example of salt in diet. So keep that example and protect yourself from blue light to as much as possible. Now, whether blue lights help, yeah, certainly they help. There's a science behind it. Basically, blue light, if not taken care of, can damage cornea and retina. So blue blockers absorb 97% of the light. That's what studies have shown and proven. So blue blockers glasses certainly help, but this is not the sole remedy. You obviously have to take a good diet. You should also follow the exercises and yogas and other things that will certainly help you. And now the role about diet, somebody has asked. I've already elaborated what is the role of diet. You can eat a lot of green veggies, put a lot of orange and red fruits in your diet, eat lots of nuts, seeds, which probably not all parents are aware of. So you can add chia seeds or sunflower seeds in your diet. That will certainly add more lutein and zeaxanthin in your regular diet. So somebody is asking about exercising. So I have explained already, but what you can do is I'll share the link about the exercises. That link you can go through it. If any further queries or you need, you can just stay in touch with us at any moment of time. We are ready to help you at any point in time. We can take one more last question because time is running out. We can take last question. Is there any question further? Okay. One question is, whatever you learn, does this really help? See, this is all what I'm talking about or discussing has proven scientifically. And see, as I said about blue blocking glasses, 97% of the blue light is absorbed by the blue blocking glasses. So this helps. Exercises and yoga are definitely, this is your new concept. It has been very ancient theory and certainly helps us. In fact, we are treating this problem for almost a very long time in adults. In children, we are seeing this problem very often. And many kids are approaching us for this problem. And if you want, I can share one of the testimonials if I have. Before ending my session, I would like to just convey to all my friends, this time too shall pass and mankind will emerge much stronger and wiser. Hope today's discussion will help you navigate through this time safely and smoothly. Give lots of my love to your children on behalf of Mahavir Super Speciality Eye Hospital. Thank you for patient hearing. Thank you so much.
Hello everyone, I am Shlok, a 10th grader studying in Delhi Public School, Pune. Due to this ongoing pandemic, all the schools and institutions have been shut down. So, to continue with schooling, we were all introduced to this new concept of e-learning. Unfortunately, this concept of e-learning didn't turn out to be as fascinating as I thought it would have been. My eyes were now being exposed to the screen for around 5 to 6 hours a day. On top of that, all of my outdoor activities had come to an halt. All of this summed up leading to redness and irritation in my eyes. I consulted my ophthalmologist who recommended some eye drops and also gave me a pair of blue blockers. I also followed his advice of washing my eyes with clean cold water after every lecture I attended, along with looking at soothing colors, particularly the greens. These small steps helped me to a great extent, and now I am able to enjoy my TV time as well as online schooling without any hindrance. Thank you, doctor.